Britta. I thought I'd saw Britta just jump on. Welcome, Britta.
Hello.
Okay, I am going to start. And Emily Mentor, I have been at times if my audio is cutting out. So I'm going to, as we go through this, I don't normally do this, but I am going to turn my video screen off just because today I have been having some issues with the audio. So as we go through, if it gets better or again, I don't normally want to do this, but because the audio has been a little bit today in Zoom meetings, I'm going to just turn myself off so I am at least clear from that perspective. So first off, as always, thank you for everybody joining us again. Obviously, since the last time we have met, we have received new guidance from the Oregon Department of Education and the Oregon Health Authority. So I will talk through some of those pieces today, share some of our next steps of moving to in-person, and you're going to hear me reference limited in-person as a starting point. And then, and again, just if everybody can just check that we're on mute. I believe everybody is.
So it's like, yeah.
Mark.
Let me see here.
Mark Middle.
Let me put that on.
Not on mute.
Mark, if you would mute for me, please. Thanks for that. Appreciate that. So we'll share a little bit more about that. And then obviously I'm going to share some metrics of where we are, as I do every time. And so we'll go through some of those. And then we do have some questions that we want to pose with the group this evening as we end. So as always, please, we will use the raise hand, or you know, we are watching, or I'm watching if a hand raises for people that are on camera, so I'll pay attention to that. But you can also put questions into the chat, as we always do, as we move forward. So with that, here's again our agenda. Again, as I always do, district goals and agreements we'll quickly go through. Then we're just going to go through some of the key components in the new guidance. I'm going to talk through potentially on-site testing. That is one of the new areas in the guidance. We're going to go through the new advisory health metrics, the current metrics within the school district, Polk County, Monmouth Independence. And then I'm going to give you an update on vaccine. And then I'm going to go through some of the key highlights of changes in the reopening. And then we're going to talk through limited in-person phase-in. So we're going to give you the definition of what that will look like, and then our first phase one of that process. And then again, next steps and follow-up meetings. And then we're going to go into some just review of the questions we talked through last week. And then we do have some group questions today. We are going to stay as a whole group today, not into breakout rooms, because of just some questions we want holistically for everybody to be able to help us with at the end here. So again, real quick, as we normally do, we want to ground ourselves in what the strategic goals are for the school district. Again, student growth and achievement, that we are really trying to move forward to building and preparing and challenging students as whole children, so they're successful in college, career, school, and community. Obviously, every time the importance of partnership and the family involvement. So we're building systems that our families feel welcome, supported, safe, and valued. Continued community partnership. I, again, in so many ways, can't thank the partners that continue to be and work with us as we work through these unprecedented times. And then obviously the leadership of and the continued improvement of our staff as one of our driving factors as we continue to grow and learn and improve and do that in a respectful way where we're gaining trust in our decision-making and our teamwork together. So again, grounding us there. Again, quick agreements, our community committee agreements. I appreciate everyone staying engaged. Experience discomfort. I know we are all dealing with that in many different ways. So please stay with us with that. again, we always are wanting people to speak your truth as we are listening to all voices and, making the best decisions as we can in moving forward with our community, our students, and our staff. Listen to understand, please, making sure that you're putting yourself in other people's shoes and having that empathetic view that we are always wanting to make sure we're doing as we work through. Expect and accept non-closure. I think we're all used to that right now. May even be fatigued about that, but we all know that we are still working through some of the uncertainties as we continue forward. We do a good job. I'm really appreciative of everyone in the Equitable Voice. Continue to assume that best intent, even when conversations are hard, and that we're making the best decisions for all CSD students. And we're vetting best through kids as well as, our staff and then the community in general. And then continuing to obviously work from our agenda for each of our meetings. So I just want to start here because this is continued theme in our maintaining health and safety, really in the Ready School Safe Learner. So again, we are continuing to follow and make sure that we understand the virus. So again, as Dr. Fauci continues to say, we may not set the timeline the virus is really setting that. We know that we are in a state that until there's widespread immunity, we're going to still be working through the pandemic. We also know that the best tools, and again, I sometimes, as I share with you all, feel like a broken record, but that physical distancing, the face covering, and good hygiene is part of that consistency to keep healthy and safe within not only our schools, but in our community as a whole. And then again, just that clarity, every health restriction lifted is an opportunity for that transmission to potentially increase in those cases. So again, just how we ground ourselves, this is some of the key pieces that we continue to just keep at the forefront as we are making decisions. So this was, again, and it is going to be a little bit repetitive, but we are just, as a reminder, we know that these are some of the key practices in preventing the spread of COVID-19. Again, as we move forward, we know that the distancing and keeping social gatherings down, obviously the hygiene piece, cohorting, which we're going to share about and what that looks like. Both in a bigger picture as we move forward, but in what does that also mean in a limited in-person beginning steps. We all know that the face masks are a huge part of, and the face coverings for the stop of the spread. And then obviously, if we were to have any type of spread, the process for isolation and quarantining, cleaning and disinfecting, and then the airflow and ventilations within our school systems, and what that looks like as we move forward. It was clear in the guidance, and you'll see this, that there were important factors to consider, and there were two that were called out with the new guidance as we move forward. And one of those, the first piece is case rates. It was clear that they are making it clear to us as school districts and with our partners at the Polk County Health Department that the case counts or case rates are part of that critical decision making, because we know that can impact and destabilize the learning environments. And so having an understanding of that, using that data, and then making sure that we're following the correct processes. So again, one of the key factors as we continue to return to that in-person at the school levels. And the second one is just the public safety protocols. So our ability as a school system to implement that safety protocol requirements with fidelity. And again, that's entry screening, which we're going to talk a little bit more about today. Obviously, the universal use of face coverings, the physical distancing. Cohorting becomes a big part of that. We have talked about that previously, but we will spend a little bit more time today with that, and answering any questions as we move forward. And then the frequent hand washing. Again, both of these are referenced on page 14 of the Ready Schools Safe Learners. So one of the new areas that is in the guidance is if and when we choose, or should we choose to move to a model of on-site where our county is outside of the new advisory metrics, which I'm going to talk through here shortly. By no later than March 1st, we would need to implement on-site testing. And that on-site testing would be for both students and staff. There would be, we are working through that right now. There's a pretty lengthy document of what that would look like within the school setting. We do need to have a test administrator. We do need to report the information through a portal to the health department and what that looks like. We also know part of that process is working to get information to families, because obviously we need approval to be able to test students within the school setting. So we'll continue to share more, but this is one of the additions to the guidance. We had heard that this potentially was going to happen. And again, I want to be clear that the way the guidance is listed is that if we are in a county and we choose to go to an on-site model and we are outside of that advisory guidance, then we would need to start with testing. So again, that's also on page 14 of Ready Schools, Safe Learners. So this is a new part of the requirement in the guidance. The other piece, just for clarity, is in the guidance, they made this, and again, it's always been there, but they made it clear that we will always have to have a comprehensive distance learning model. So again, if we are in a county that potentially is going to move forward outside of the metrics, that we must still have a comprehensive distance learning instructional model for families that may not want to come back into our schools, that there's that ability to choose to remain off-site. So again, we know that is, again, that's always been part of our conversation because we know that families may not be ready to move in that direction. So again, just that continued option for families. So I'm going to spend a little bit of time on this. So this is the new advisory metrics that were released with the new guidance. In previous guidance, when you look at the red area on the far right, that used to be 200. So now if you are higher than or greater than 350 or in that range, it is advised you're in a distance learning model. And then you can, the priority is comprehensive distance learning, and that you can have limited in-person instruction within your building should you choose to do so. And again, looking at the metrics and having continued conversation as guidance from the health department and making those decisions. And I'm going to go right to left. I'm going to go right to left, and then, but I want to talk, we're going to talk right to left, which is not normal, but I want to just quickly on the left side where it says metrics and model, some of it is the same areas that we're looking at from a data perspective. So the county case rate per 100,000, and that's over a 2-week period. So again, those 14-day look backs, and then the county test positivity rate. And then that last one is the advisory instructional model that you would potentially be moving in and out of. So again, not a lot of change there. Where you're seeing the change, and again, I'm going to go right to left, starting with the red, that has changed to 3. If you're less than 350 or greater than 350, you would, the priority is to be in comprehensive distance learning with some built-in limited in person. If we were in the orange, between 200 to 350 per 100,000, and potentially a case rate that's around 10%, we could begin prioritizing and phasing in some either limited continued implementation of limited in person, and then starting to move towards what would be more of a robust hybrid model. And again, obviously starting with younger students, because you see that elementary on-site as part of that. And then again, moving to the yellow, again, looking at the case counts between 50 and 200. Again, it's a much different range than before. And then obviously the the test positivity range between 5 and 10%. And we're going to talk a little bit about that because I'm going to go the next slide and this slide. We're going to go back and forth a little bit as we have this conversation. And then anything that if we're less than 50 and then under 5%, then we can be moving all buildings. In the yellow, as you're starting to potentially have some of those areas in the orange yellow, you can start to look at some limited in-person at the secondary level. So I'm going to pause for a second and just, are there any questions? Because again, the numbers have changed. The colors have not so much. I think that one other change is the white box below the orange and the orange and the red. Previous guidance shared that if we hit these levels, we had to bring on-site down. That is, if we are in on-site types of learning and cases go back up, we can keep those on-site still going. Again, if we're working through some outbreaks or things like that, we would potentially have to bring it down. But if we have good solid protocols that we would be moving forward hold on for a second. I think we have a couple people.
Norma, we've got your microphone on.
Oh, sorry.
Thank you.
So let me go back to this. So we would be able to, I apologize, I didn't mean to move that slide forward. The bottom part here allows us to, again, if we are open and should our case rates go back up, we can keep those groups in the school and on site. And that is a little bit of change from the previous guidance. So that's a good thing as we get into bringing students back. Because we feel very confident in our protocols on site. And like I said, I'm going to come back to this. We're going to go a little bit of back and forth with this for the next slide. So here is where our current metrics are. So I'm going to start with the positive. If you are looking at the county case rate, which is the upper part of this document, we are moving in the right direction. We are still in the red, but we have for 2 cycles, so two weeks in a row, so a month, we have really moved from 481, which was started on 12/27. When we look at the weeks of 1/3 through 1/16, dropped to 460. And then obviously this last 2-week look back, which is great news, is that we're at 368.9. So again, that's 2 cycles, and that's going to be very important to us because we are looking at a 2-cycle drop. That's part of our continued conversation of, are we seeing that continued drop within the metrics? And then the second part of the data is again that we didn't really see any drop last week in the county test positivity. But we did see that first drop for the week 110 through 123 in the county test positivity, which is great. So I'm going to go back because one of the things we're going to talk through today is as we start to talk about what our first phase will be, which is limited in-person learning, because we have seen a 2-week drop in the red, and because we're seeing that first week in the orange. So I'm going to go back here. So now I'm sort of working in both the red and the orange area of the advisory metrics. And to some degree, a little bit in the yellow, because again, orange and yellow, when it comes to test positivity, you're seeing some of those 7.8 sort of falls in both of those categories. So as we've been working with our administrative teams and in collaboration with our union leadership, we are going to talk more about the limited in-person first step at a K-12 approach. So again, these metrics, and they are moving in the right direction. Again, the last 2-week look backs are both 2 cycles are down, which is great. And then we saw our first cycle of the county test down in the orange / red here. We're putting it in the orange right now. And again, if we have those 2-week cycles, that will be moving to that yellow because we want that consistency there. So I'm going to pause of questions about this or comments, because again, I think this is where we start to use this tool and with our data specific to the county case counts and positivity.
I don't see any questions in the chat, and I don't see any hands raised.
Thank you.
Jenica just unmuted. Did she have a question?
Oh, I did. I wondered if obviously the metrics are important, but if looking at where the cases are coming from comes into play at all. I've had some conversations with one of our county commissioners who has said that more than half our cases have been coming from the retirement community, which would make sense why our cases are dropping so much, I think. You know, is that looked at all when we take into consideration when to allow schools to reopen, or do we just look at the metrics? Does that make sense?
Yeah, and I'm going to go to that next slide because that's part of that conversation of looking at what the specific within our 2 towns. So yeah, that's part of the continued looking at our data from that perspective. We also keep data within the school district of, you know, if and when we have staff that are either have reported to us that they have tested positive or have, you know, again, we have to look at potentially have they been around people that have been positive. And we also at times do have information on, you know, students that have reported to staff or parents have shared with us. Again, we look at those. We don't tend to share that data because it's not, the N is very small, but that also is part of that conversation. So I'll move to that next slide, which sort of talks through a little bit of Jenica, what I think you're referencing here, as we continue to use, look at all the data points. So we are making good decisions for within our community, but also looking at other what's going on holistically in Polk County. So this slide as an example, this is a holistic look at really what has gone on within our total cases within each of the areas. So again, working from left to right, the cities are listed that we're looking at. We're looking at, this is the second column, their total population, so we can just see the difference because these are the 3, when you look at Polk County's metrics, these are the top 3 cities, towns that are have the highest case rates. So their total cases are what is within the county total for Dallas, for Monmouth and Independence collectively together, and then West Salem. And then you see that they do it in a larger percentage, you know, from a case rate perspective in that 1, 2, 3, 4th column. But really what I want to focus on is the last 2 columns. So just showing the differences in populations, right? We are 8% bigger than Dallas as an example. And then West Salem is 32% bigger than Independence and Monmouth. So then if you start looking at the differences in the total case rates based off of that population, we are 40% higher in case rates than Dallas, although next slide you will see Dallas has jumped a little bit. Last time we showed this, we actually shared this last week with our board workshop, and the difference was 44%. So Dallas has jumped a little bit in the last 2-week look back. And then we are only, or excuse me, West Salem is only 2% higher than our case differences in Monmouth and Independence. But again, they're 32% population larger than us. So those are some key metrics that we just, you know, again, we're taking all of this data into consideration. We're taking voices that we're hearing, both internally and externally as we make these decisions. We continue to have and receive guidance. And I want to be clear, guidance comes from the health department. We, as in the school district, are the ones that make those final decisions, but do have to make sure that I'm listening to them, because their job is public health, and that's I have to be a part of that solution. So again, we use this as just as another data point, because a lot of we're being compared, and so we want to be transparent of the ones that have the largest or are closest, and what we're being compared with, of what we stand for differences in case rates. And again, you can see at the bottom here, if you go to these websites, especially the last one, that interactive zip code map is where we get the population, the total cases, and the cases per rate there. And that's from Oregon, the Oregon Health Authority. So then the last one is, and we as Polk County, I think I shared last time in this meeting, since really December 30th, after the governor released her information on December 23rd, I pulled together what we're calling a Polk County Collaborative. That meeting is a combination of the health department, all of the public education schools. We have had a couple of the charter schools also join us as we continue to have these conversations. A lot of it's been focused on vaccine, having an understanding of what the testing might look like. But throughout these conversations, we also have asked from the county to each week give us, and we started this on the 27th, can we actually see in each of the zip codes per week, what is our case count, our positive case count. So again, this is just really almost a month look of where we are with the total positive cases that we're seeing within each of the areas. So again, obviously we're putting Monmouth and Independence together because that is our community that we serve. Then you see West Salem, which actually West Salem is dropping. We have dropped also, and then Dallas dropped a little bit. Dallas did not drop as much as the rest of us. So I know that they're watching that as well in our continued conversation. So again, just another piece that we're continuing to look at and having conversations. I want to be clear that it's really good that cases are dropping. We know that that is a small piece. It's a small representation of our county as a whole. And as we were talking even today in our collaborative, the health department did share again of just that reminder as a community that we have to holistically do this together. And that, that the community or communities within our Polk County, the physical distancing, the mask wearing and the hand washing, they couldn't say enough again to just remind everybody that is a huge part of us opening and staying open within our schools. So again, we're going to continue to track this information. I will continue to share it at these meetings. This type of information will be shared at every board meeting. So we continue to share and show how we're looking at data to make those decisions as we move to that, back into an in-person type of model. So positive, today we started with our K-12. So everybody knows that the governor announced this early this week, or had previously announced, but that this week would be the starting of vaccine. We have started that process. We originally on Monday released information to our staff, and I'll be very honest, the vaccine process has been a holistic Polk County effort. Part of those collaboratives have been us working together, making sure that we are equitable across Polk County with all of our schools, and that includes our charter schools because they are part of that grouping to move forward. Because there are two of us, Dallas and Central, that are quite larger than the other school districts and charter schools within our area. So we had originally shared out on Monday that we were only going to be able to start with our K-8 educators. So that was where we started. Actually midday yesterday, we received information that we actually received a few more vaccinations within Polk County. And so we were able to move yesterday afternoon and communicating out to our 9 through 12 staff that they could begin signing up to start that process. So that started today. I've talked to several people who are in and receiving their first shot, and you're going to hear us a lot begin to say shots in arms is what we're wanting to move forward with, and working with our staff to make sure that they are doing that and can continue to move in that direction if they would like to. I think one key piece, as I shared, I think I shared last time, we did get some guidance. We do have some staff that was able to go sooner in phase 1A, group 4. And so we are in the midst of moving to have all of our educators move forward. We do have one more group. So our K-12 educators were really our first two groupings because the vaccine that's going to be a concern. So the amount of vaccine that is delivered to the state of Oregon is not a lot. I sit Tuesdays in the governor's office meeting with them talking about vaccines. They're very clear that we only get a certain allotted amount for the state, and they are working extremely hard to continue to move through phase 1A and move into 1B. We still have in this state, some areas of our state, as an example, the metro area has not done, are still working through phase 1A and can't even move into 1B because they're not far enough along in phase 1A. So we've seen some shifts in vaccine, how many we get. I understand that, we understand that. And I want to be clear, we need to have our frontline people, our doctors, our nurses that are on the front lines, they do need to be vaccinated. So I do appreciate the leadership of our really government in making those decisions, because those workers do need to have that as well as we do. And so we have seen a shift in the amount of vaccines we receive to Polk County. However, again, we did receive some positive news this week that we could actually open up to all of our, what I'm going to say is our core K-12 educators. Depending on the number of vaccines we receive in the county next week, the last group that we will be focusing on will be our student teachers. So student teachers fall in that area, tutors, I'm missing one. Which one am I missing? My team, I'm blanking. Student teachers, tutors, I'm sorry, coaches, our coaches, and then contractors or other groups that we may have agreements with to be part of those, to be that next group in the vaccine process. So hopefully we'll have good news either tomorrow or the next day. I have good communication with the hospital right now, and having very transparent conversations about how many vaccines, so we can, as a Polk County, with our health department, with the hospital, with all of the school districts, getting through that group 1A so we can all continue forward in those processes. It is a 2-week process, it is a 2-shot process, that we will go through as a staff. And so we know that that's going to be really from now through March that we go through those processes with our staff. So we're excited to it. And the last group is also our district office will go, again, I'll find out tomorrow if we have enough, if there's enough openings. Our goal is to hopefully have the district office go this week, but if not, then they would go the following week. So really, really positive news, but still some pieces that we're having to continue to work through with the amount that we receive within the county. I will tell all of you, we have a pretty amazing health department and hospital. I can't say enough good things about them, and them partnering with us and helping us work through how do we do this? How do we do this in an equitable way across Polk County? Early learning is part of this conversation. childcare providers, so anyone that runs a childcare facility, you know, and we only get an X amount, they're having to reach out to both of those groups as well, not only us. So just have been really, really good thought partners and leadership within both our Polk County Health Department and the West Valley Hospital leadership there as well. So I just want to publicly say to them, thank you and appreciate the continued partnership as we move through this. And then it gets to this, and I know Emily's on our meeting today. So the Western Oregon has been doing a great job of sharing, and I know this is a little blurry. I blew it up because I wanted it a little bit bigger. But this is shows the total populations that have had at least one vaccine dose in all the Oregon counties. And again, remember, although Polk County may be smaller, we're a pretty small, large, mighty county. We are the third highest in getting vaccinations in the arms of our community. I think that gives huge success again to our Polk County Health Department and the West Valley Hospital, their relationship with Salem Health, and how we continue to move forward with this. So I just wanted to share this. It's nice to see that. I mean, we are considered a large county. Again, we're not large like Metro, but we still are considered in that area. And you can see that we have 9.4% of our population that has at least one dose in. So Emily, I just want to also publicly say thank you to yourself and your team for putting this together. I think this is a good resource.
We appreciate it. Thank you.
Questions? Janica, good question. Yes, subs are in that. I apologize if I didn't put that in there. Yes, subs. So it's student teachers, it's substitutes, it's tutors, it's coaches, it's anyone that is contracted that might be on site, because school districts do have different contract types of things where we would have people on site. That is that last group. So yes, I forgot to say that. So thank you for that. Other questions are about just sort of health and safety and the advisory metrics before I move forward?
We don't see any.
Okay, thank you. So I'm just going to do some high-level highlights because as as a superintendent, you never know what the protocols and the new guidance is going to change. When we received it on the 19th, there were some shifts, and I'm going to share those at a high level of some of the things that are changes, and then some of them really aren't changes for us. They were already part of it, but the Oregon Department of Education has put more emphasis on certain areas. So I'm going to just take a couple minutes to go through. If you remember, in the guidance, there are 8 areas that we go through. So again, public health, how we deal with facilities and operations. We have what our outbreak process is, equity, the instructional models. We also have, what's our engagement with community, obviously with this group specifically, and then how we're continuing to share information, gather information in many different forums. Also the mental, social, and emotional health of our everyone, and then what that looks like, how we build it, that it's at the forefront, and then obviously personnel pieces. So this one is specific to the public health protocols, specific to infectious control. There is a new risk assessment that we are working through, and it reviews requirements. I know at the last meeting we had talked about in the governor's 5 points that the Ready Schools and the OSHA, which is really the body that looks at workplace safety, that there were some disagreements within both of their guidance. So that has been cleaned up, and we're working through a risk assessment just as a document on file for us. There's also a process that we are starting with our district safety committee. We have to have an anonymous complaint process available to both community and our within our buildings, families, that if there is a concern that someone may not be following, or we may not have the appropriate, or someone feels that our safety protocols are not appropriate, those types of things. There's that we have in the school district an anonymous complaint process, and then we would work through that based off the information that we have. So we're in the process with our safety team to build that. They emphasized training of staff. We have continued to do that. We worked with our K-5 because we know that they're going to be some of the first groups in. And so we did some training with them coming out of our winter break. So that will continue. Again, just the protocols for notifying our public health. We have really good protocols and open communication with them. And then just that continued cleaning, disinfecting, and hand sanitizing is an emphasis. So I'm gonna go into a little bit more depth with limited in person here in a little bit. As I said, we are going to be moving, our first approach will be implementing limited in-person instruction. And again, as I said, based off of the metrics, we are moving with limited in-person from a K through 12 perspective, and I'll share more about that. But a couple of things that were highlighted in that guidance of updates. So we can have up to groups of 20 students in that limited in-person, but they can't be larger than 2 groups in any given week. And you're going to hear me say this a couple times. So with that, and then we can have them on site for 2 consecutive hours. So really this is tied with how we continue, because if your metrics are still not, or they're still in that red zone, we can move into limited in person while still doing that comprehensive distance model. So again, we're going to talk a little bit more about that, but there was some updates with that. That cohort size used to be up to 10. It has been changed up to 20. And then again, the 2 hours has not changed. On the right side, cohorting becomes a big part of, as we move from a limited in person to more of a hybrid model, which would be more on-site time for students. We actually, we can't exceed 100 people in 1 week for those students. So we just have to be careful of that. Again, cohorting becomes a big part of this. We have to keep a daily log, which we will do. And we were already doing some of that already as we started our first brief limited in person. And then you have to minimize the number of staff that interact with each cohort. One of the key pieces that was shared with us that we've been is, being very thoughtful about that of where staff are, because again, every staff that moves from cohort to cohort, again, we know that there could be impact if that person were to be exposed, have a positive test for COVID. So again, taking that very, looking at that and what that's going to look like from a staffing perspective. So again, cohorting becomes a big part of this conversation moving forward, and I know our principals have been hard at work as we move forward with this, as we share a little bit more tonight. The other emphasis in the public health was the entry and screening. It was very clear that we need to be diligent with this. One of the key things, and we're going to talk about this at the end with everyone, is we also know that we're going to want parents to do some of this screening before you even start to come towards school, whether that be putting a student on the bus or sending them off to walk to school, or even you dropping them off of, this real screening of, are there any signs or symptoms? Because we have to be we have to be clear, and we will continue to share this. And you can see it at the bottom. We are going to need, and we have said this to our staff, we are going to need both students and staff. We are going to need them to stay home if they are sick. And again, we all know that allergies is allergies, and you have to know your body as an example. But if there are sniffles, if there's a high fever, if you have a cough, some of the main symptoms, that's going to be a big part of working collectively together, because this type of screening allows us to keep doors open. If we are sending students to school sick, or students that may have been exposed to someone that has COVID, it's going to be, we know that could impact us in the building and what we're trying to accomplish. So this is going to be a big part of our process. This was a huge emphasis in making sure that we're asking, good questions of our youth coming in the door and or parent, but then also how we're going to partner with parents as we do this work together. And again, more information will be shared, but this was one of the big emphasis from the new guidance. The other one is just that face coverings, not that this wasn't said before, but it is a requirement, and they made that clear for us that this is required, that, you know, masks that we are required to provide. We have resources and already have allotments of face coverings if a student were to come to school without one. So all of those pieces we have already have and are ready to put in place. They are required for kindergarten and up. We know that potentially we will need to work with students who may have medical restrictions that don't allow that, and or students experiencing disabilities that may be part of that. You know, those are different processes that we'll work through with families. But again, this was a huge emphasis in the protocols. You will see at the bottom, this is actual language in the guidance that if we have students or families who do say to us, I do not believe in wearing a face mask, then we are allowed as a school district to say, sorry, you can't come in person. You will need to stay in comprehensive distance learning. So that was articulated within the new guidance. So we all know that this is one of the key measures to help us keep schools open and safe. And again, I'm not going to spend, this is a whole, we've talked about a little bit with you all about, you know, what does this look like when we do have an isolation and quarantine process? We have a really good system for this. There have been some changes in the amount of quarantine time. And so we'll, again, continue to communicate that as we get into this for schools, should we have any type of outbreak. The goal is that we don't, but we do have really, this is some just new documents, infographics, as I like to call them, for people to see of how, you know, this would look like within a school setting, to just get an idea. The exciting news, transportation, a couple things. So it was not stated in there before, and this is under the facilities and school operations section. Transportation, the face coverings are required. That wasn't clear in the guidance, so there was clarity about that. So students are not going to be able to eat on the bus. That has, you know, I know that has been allowed before, but obviously being in smaller spaces with their masks off, even though they're going to be distance, we know that could still spread that. So face masks will be required on the bus. We're going to take all possible actions for ventilation. So we're going to communicate out. We need to make sure those students that are getting on buses, especially as we move forward in these a couple final winter months, that we're going to need to dress warm, because at times windows will be open, right? That circulation of air as best as possible really helps us to not, or to really cut down on that extreme, or if we were to have, you know, ventilation in there, to make sure students are, you know, those open areas are much better than being in a small area. So we're going to make sure that windows are open, so ventilation is happening within the buses. I think the other key change is busing was previously, or we thought was previously, and we got that clarity this last Tuesday. So buses is not considered as one of the cohorts. So busing is its own cohort. And then when they come onto campus, if they're as we begin in limited in person, we can only be in 2 cohorts, or if and when we move to hybrid, they can be with 100 students. So that was good clarity, because that had not been shared with us previous. So we're excited about that change. It's going to make things much easier for us to cohort and get kids to school from a transportation piece. This was a huge barrier for us. So on Tuesday, when we got this information, we were actually extremely happy, because it helps us immensely. And again, not that this is new, because we are doing this and we'll continue, but the cleaning, disinfecting, and ventilation, we're continuing to, again, they emphasize just those frequently high touch surfaces. We know cleaning is a huge part of it. I give kudos to Brian Weatherly and our custodial staff for the work that they are already doing and will continue to do. And then again, that we're providing time and supplies for those high touch areas. That would even include in the classrooms and even in the cohort. So again, just a re-emphasis as a reminder within the new guidance. And then, oops, excuse me. In area 5, just that reminder that we will again have to continue to have comprehensive distance learning in the event that there's an emergency closure. So that was clearly identified in the instructional model from that perspective. And then finally, again, this is not new, but again, emphasized in 8 that we are doing trainings and we continue to do trainings with our staff. So we have already built some videos that have been shared. We did some training, washing hands, social distancing, video about, what it looks like walking in, what's that process look like, and then also, staying home if you are sick. So we have done some of those and shared those out, narrated some pieces, and have some videos already shared with our principals, and we'll continue to do that training with our staff. So we're excited about that, and we'll continue forward with it. So I'm going to take a minute. So we are, as we've shared at the last Thursday in our board work group, we are moving to a limited in-person phase-in. Again, our counts are still up there, but they're going in the right direction. We're seeing good things in that area. And so we are going to start with this. And I'm going to take a little bit of time here to
Jen,
yes.
sorry to interrupt. Good
problem.
question from Norma Rodriguez that we might want to talk about in the chat, asking about staff who are declining the vaccine.
Yes.
Will they be allowed to work in schools? I thought this might be a good time to address.
Yes, appreciate that. So we are not requiring, there is not a law that it requires staff to get vaccinated. That is a choice. Again, that is going to be up to them. We know that is an option for them. We are, again, we're going to continue to share that we do want staff, but we know that there are circumstances that may not work for them, and we understand that. If and when, again, we're going to start to transition back into the buildings, and I'll share a little bit about that in a minute of what that time frame looks like. But again, we will have staff back. Again, staff will be in buildings, whether they're vaccinated or not at some point as we move forward. But again, I want to be clear about, we also know that the health department was very even clear with us today. Vaccine is one of the tools in the toolbox in fighting COVID. It's one of the tools. It's not the only tool. The other tools that they are very, very, they make sure that they tell us to share with the community is, please keep your social gatherings down. Please keep social distance 6 feet or more. If you are in, groups, staying outside is a benefit to that, wearing a mask, and then the hand washing. So all of those are tools in our toolbox to fight COVID. We have had staff in buildings, administrators, teachers, classified staff that have been in buildings. We've been following these protocols and again, are working in these environments on a daily basis. So again, I want to be clear, we are in constant conversation with our union leadership. We have meetings every other week, or if we need to even add meetings, we continue to do that. Again, you heard, and we're very clear that we're collectively doing this together. We know that they're an important part of that process and continuing to have those conversations, but it is not a requirement as we move back into the buildings, and again, starting with limited in person. So thank you, Cease, for catching me on that one. Okay, so limited in person, and I want to say this. So there's two pieces that we're going to start working through. We're going to have limited in person, and then the goal is at some point, hopefully, that we would move into hybrid. I'm not going to talk much about hybrid today. I'm going to focus on limited in person. So what you have in front of you is what I'm going to say is the definition of what limited in person looks like. So again, as we shared earlier, cohorts cannot be larger than 20 students. And to some degree, because of metrics still being slightly in above the 350, we may start smaller than that as an example. So no more than 20 students in a given cohort. Students cannot be part of more than 2 cohorts in any given week. So again, we have to be careful of the cohorts they're in. So they only have 2 within the limited in person. We are allowed to have them in the school for 2 consecutive hours. And it cannot be 1 hour in the morning and 1 hour in the afternoon. It has to be 2 consecutive hours as part of the definition. This is in conjunction with comprehensive distance learning. So again, if you go back to that advisory metric, we are still in the red. So it is advised to be in distance learning, but there is that caveat that we can have, start to have students onto a limited in-person approach. So again, that is in conjunction with the comprehensive distance learning. With staff, one staff member cannot interact with more than 3 cohorts in a given day or 5 in a week. So again, we're looking at, total number of students that they would be in contact with. Again, if you remember, no more than 100 per week, that's where that 5 in a week equals the 100 from the first bullet above of 20 students as an example. And then this approach is based off of identified needs, and again, is subject to these limitations. So again, the time amount, the cohorting, and the number of cohorts. So this is where we are starting to phase in with limited in person. So this is the definition. So again, we have been, really the elementaries have been reaching out as we have seen as we've looked at our data, and we're hearing that the test positivity rate was going into the orange for the first week, which was great. We are taking this as really looking at how do we do limited in person in the K-12 approach. So I'm going to go next slide. This is our phase 1. So we are looking at, from a K-8 perspective, students that have had significant absences, and really those students that have had the most impact for that. So our principals are working through that right now. And then at the K-8 level, those students with no internet, or that intermittent where they have it and it goes away. There's lots of conversations that happen between staff and our principals. I want to say we have worked extremely hard. I'm going to thank MyNet and the cities and their partnership for what we've done with the grants to be able to keep families connected. I'm very appreciative of that, but we do know we still have issues with that from an infrastructure within our community. So that phase 1 will be really focused on, from a K-8 perspective, those two areas of students. For 9-12, we know, and it was in my conversation with our Principal Servagna at the high school, we need to pull in seniors. We need to really focus on seniors that are in need of credit recovery. And so that's going to be the initial phase 1 approach for us in limited in-person learning from a K-8 and then 9-12. The goal is, we are only sharing phase 1 at this point, because again, metrics are going to continue to be a part of that. We will continue to share out as we build. We are going to build a community communication out, sharing this information through tomorrow, and either we're going to get out tomorrow or Friday so we can get this information out to families. But I think I want to say that green area at the bottom here is, if families do not want to do this, if you get the phone call, your student falls into, potentially one of these areas, and you may not feel comfortable, still, that's okay, because we are not going to force people in. So again, this is that, you guys heard me, we're trying to go small to grow into this. continuing collaborative conversations with our staff, listening to all the voices within our community to move forward, because you all have heard me say, when we open schools, I want to keep them open. I have seen schools go up and down. When we open schools, we want to slowly move forward and keeping them open and continuing to build in that direction. So again, this is our first phase in for limited in person. So just want to talk through of what those next steps look like. We continue with that Polk County Collaborative because there are things that are still coming up that we are needing clarity from and guidance from the health department. Obviously, we're having our meeting tonight. We'll continue to share information. We have a board meeting next Monday where that will continue. We're continuing with the staff vaccination process. Again, that's began today. That will go through March. We know that that's part of that process. We will begin to transition to on-site operations within the buildings as we shared with the board last week and through February, March, and continue to move in that direction with our staff. But again, making sure all safety protocols are in place. They're continuing to work through the vaccines. We know some staff are already on site and ready to go. So continuing to have those conversations holistically as a school district. And then you can see we're going to begin limited in person with the first cohorts of phase 1 on or before February 16th. Because again, when the governor shared February 15th, that's actually a holiday, a federal holiday. So we would begin this on or before February 16th for K-5 and seniors in need of credit. And then the next week, February 22nd for 6 through 8. And again, I'm going to go back one slide. It is with this group that we are looking at of students that we would start to move forward with that. We will continue to monitor case and test positivity rates because again, we know that that's part of our decision-making process. We'll continue to be transparent about that and gathering that information. And then obviously we will continue training and professional development with our staff. That will be constant really throughout the rest of the year as we move forward. So again, I am grateful as a superintendent. We know that there are a lot of voices myself and the board continue to listen to. We collectively, all of us, because all of you have voice in this as well, what you share with us, your concerns, our conversations with our staff, continued conversations with our administrative team. All of those are some of the key things of where we are and how we're going to continue forward. And I'm going to, again, I apologize for sounding like a broken record, but my goal is that as we start to move to open up, that we stay open. And that is a big part of the continued conversation. So metrics, continuing to move forward with vaccines, all of that is part of that decision-making process. And then as we make steps moving forward. So I'm going to pause. Questions as we successfully move in that direction. Just looking. Any questions?
I don't see any, Jen. There's a comment from Brianne. She appreciates that we're starting with the most impacted students.
Thank you. And I give great credit to our principal leadership. They have, again, their voices are strong, and I'm very appreciative to the 5 of them and then all the staff that continue to work through with them. So, give kudos to them for really advocating and being thoughtful in that for our first grouping. So thank you. So the next piece I want to talk about is just shared information and I do want to have more of an open group conversation today. And I know we do both going into breakouts, and then there's sometimes I actually want us to stay together as a group today. But I wanted to just go from our last meeting from the breakout questions that we had, just some of the themes that have come through. So, it's what's some of the greatest concerns as we shared with you guys sort of that next 4-week out, what that's going to look like as we move to in-person. And again, we are moving with limited in-person as a starting point, bringing students back into the building. So one of those was the vaccine process and outline. Again, that started today. We're really excited. All of our K-12, what I'm going to say, core educators are starting that process. Again, for those that want to move in that direction. Next week, we will do really our last group, which is our subs, student teachers, coaches, etc. It was clear in the communication from my facilitators that, that we're realistic about the timeline and implementation. I think that is still going to be hard. And again, that's going to lead to one of my questions to you all tonight. We have to take into consideration if metrics go back up, all of those conversations. So timeline is, as numbers are going down, that is a positive thing for us to move. Obviously, vaccine startings is a positive thing as well. Trying to communicate out where we are in the timeline and that we update that regularly. Again, that's our goal. We know that is sometimes difficult. We always know that any communication we do, even the greatest communication, can be better. And so I appreciate that thoughtfulness to us, because we are really trying to do that in the most thoughtful way without putting dates out there, because we know that if we can't, you're seeing across the state where that's happening, and then things are being pulled back. So again, we're giving that range. I appreciate the honesty of this group of, as best as you can, give us that framework to build from, so then we can go from there. One of the other themes in this section was, again, people appreciated the metrics approach because that leads to the confidence in the safety of students and staff. And then again, there was some concern about our students are being left behind. And again, we know those voices are really important in this, and as we make the decisions moving forward. And then the last one is how do we have voices of families, really, where people are in different places. Families may want students to come in, and then others are not ready. And so how do we balance those voices in our decision making?
Jen?
Yes.
Yeah, we have a good question from Norma that sort of relates to that second to the bottom bullet about students being left behind. She asked about students that are having a hard time and how are they being graded? Or, what are we doing for those students, and how is grading working this year?
So I'm gonna say, does any one of our principals want to jump on and share what you have been working on with your staff as it relates to grades? I know it's going to be different from any level, but I know we've had this conversation. Does anyone want to start?
Yeah, Jen, I can talk about that. At the high school level, we've had some conversations all along the school year and have had to adjust to meet the needs of our students as we notice what's happening for them throughout this school year. We're reflective practitioners who notice when something's not working well, that we want to make adjustments to meet the best that we can for students. And so we started off with letter grades at the high school, A, B, C, D, and then a no pass. We've adjusted that to A, B, C, and pass and no pass. I just sent a video out to students, helping them understand, we want to do what's best for students on one hand, and not punish a GPA for something that is very out of control for some students. They may, for example, be babysitting siblings or working to support a family where jobs have been lost. We know that the learning conditions are very different for students this year, working from home very independently. And so we want to have some safeguards in place for them. We also have to weigh that with, we know we have some students who are probably going to want to look at, well, I'm getting a C right now, and that's not where I want to be grade point average wise. So I might kind of, let some assignments go so that I can get a pass that's not going to impact my GPA. So I'd encourage parents to continue looking at, where is your student, where are their capabilities, and encourage them to really think about where they are with their own personal learning. This is a different situation for every student. And so for some students, that pass, getting that credit right now that's what they're capable of, and that's what they need in a time of a global pandemic. For some students, they really could work hard and get that grade. Janica, I did talk with Emily about putting that video out. It's on YouTube, and so I can share. I'm preparing a communication to students. Sorry, I see the question in the chat. I'm doing a communication out to parents that'll go out Friday morning, and so I can include the YouTube link in that communication. And then we'll also look at putting it on Facebook. But it just talks about graduation requirements and grading and how to kind of think about that on a case-by-case basis. Where are you? What are you capable of? And what do you need to get through this year? We're working with teachers on proficiency based. What does that pass really mean? It could be based on a percentage. It can also just be based on that proficiency, that they've met enough of a standard to be able to pass. It doesn't impact GPA, but if students are not passing, they will have to redo the credit because they do have to at least get a pass or a letter grade in order to earn the credit for graduation. So in essence, yes, if students are having a really hard time and are not passing their classes, they will have to somehow redo that credit, either in credit recovery or through some sort of a creative way. We're brainstorming ideas all the time of, okay, how can we meet some of this demand in a creative way? And ODE is really encouraging us to do that this year, recognizing that students are learning how to navigate technology, they're learning how to navigate independent learning, and that in of itself has some merit to their own learning. And so perhaps some creative awarding of credits is a possibility as we continue through this pandemic. I hope that answered the question.
Thank you, Donna, very much for that. Anybody else? And I know that tended to be and I don't want to, Norma, if that's more of a high school, do any of the other principals, again, I know that obviously middle school and high school aren't tied to credits and grades, but any other principal want to share anything from that perspective at this time? Because again, I know that's been a big question at the high school. So thank you for that, Donna, from that perspective.
Jennifer, my internet isn't super stable, but I think in terms of elementary grading, we do have conferences and grading coming up. On the 3rd is our grade day, followed by conferences, and teachers are actively, reviewing all the data and evidence that they've been able to collect since the beginning of the year, because we did make a shift. So we didn't do report cards in November. So this will be our first grading period, but kids will receive their progress reports or their report cards this February. So teachers are actively working on that.
Thank you, Ashley. Appreciate that. Okay, and then I'm going to keep going, and then please stop me, either Emily or Cease, with other questions that are in there. So I appreciate that. The other question, or one of the other guiding questions that we had last week, was about transportation. I think there were some really good ideas. So I'm thankful to this committee about, what could we potentially think about, that campaign or pledge. We had a lot of different groups talk about that. How do we promote bike to school, walk to school approaches? Oh, I just see that typo there. Did you see that typo right there? As many times as you look at that, I'm going to own that I have a typo there. Even as many times as you look at something, I apologize for that. The other part is, again, what type of information do we need from parents, from a transportation need? So we'll continue to gather that information as we reach out to families. Again, a theme was staggered starts, which is a lot of the conversation that we're having. And then even those purchasing of other vehicles, buses, and hiring of more drivers. So we know that that's going to be part of it. But I want to be clear, the cohorting not being a part of the bus has truly helped us think through. So that was some good news from the guidance. The next one, again, just the increase in supervision that we're going to need to do. We really in talking about how might we do and what might volunteers look like if we have to move in that direction. So we talked about, again, themes that we know that there's going to be multiple check-in spots because we have walkers, we have drop-off, and we have buses. So we'll need to continue to look at that. How might they be supportive of that? I think this was a consistent theme in all the communication that came from the facilitators is those volunteers need to be consistent and they need to follow the protocols, and that they need to take COVID-19 seriously, and that will be part of that process of, from a vetting piece. We also know that having or bringing the volunteers in really, as we look at cohorts, because we can only have a certain amount, that could cause a little bit of a puzzle piece for us. So we just want to be cognizant of that. If we have to turn volunteers away, because again, if we get to a point, be thoughtful in it, because we know that there's lots of people that want to help, and we may have more volunteers than need. And so just be thoughtful in how we make that approach. And then how do we pull from current groups? So our parent association groups that are in the schools, we have WU tutors, we have student teachers, we have faith-based organizations. So where we have the partnerships, how might we do that piece of it? So appreciative. I think these are going to be things that we'll continue to build on as we move to in-person. So with that, we really have, I'm going to let you read this, but and I really want to, if people could open up and share a little bit with us, because a couple things. We are excited to get this going. However, we are knowing that we are going to need to do this in a very thoughtful, safe way. Again, building on phase 1 of limited in person, and then what would the next look like? What would the next look like? Keeping into consideration the metrics, which is the first question. So I am just looking for some information because again, I hope the metrics continue down in the direction that they're going. But my first question to this group is and I do want your opinions, if our cases go back up, just thoughts from you on approach if we end up having cases go up again. Again, the guidance gives us a little bit of flexibility that, as I said previously, which was different than the last guidance, that if I have groups of kids in and our metrics go up, I can keep those groups in. So I want to be clear about that. That's a different shift than the previous metric. So I am really looking for, and again, as always, if you can raise your hand or, and again, the little raise hand feature is in your Zoom, or if you want to put information in the chat. I am just looking for potential thoughts on how and what that might look like if that were to happen. So that's the first one. And I'm going to go through the second question and we'll come back to that. So just thinking about that. And then the second piece is, to some degree, some popcorning from you all, is how do we help the community support our safety protocols so we can stay open? Again, I have great confidence in what we are building in the schools. I have great confidence in our staff. I have great confidence that we will teach kids, keeping masks on, the social distancing. I already know our teachers are working on some of those lessons and ideas. But I also know that, and you heard for those of you that did listen to the board workshop, our public health officials did say the community has to be a part of this to keep buildings open and safe, because I want to be clear, our buildings are safe. We are going to be able to do things, and buildings are safe. We've had people in the buildings. We know that we're continuing to work through pieces of what concerns may be from staff, and we continue to have those conversations. And again, appreciative of the collaboration that we have with both of our unions and our staff holistically. But we know that the community is part of that. So first one is, how can you help us with this messaging? B, number 2, are you willing to be part of this communication out to the community as we transition back? Because again, we as our voices, our principal voices, but I think your voices as parents, as staff, are going to be huge in that conveying that information. And then as we think about just the information about safety protocols, because as I shared, there's going to be some screening that we're going to want families to do, that limited in-person definition. was that clear enough for you and succinct enough that if I message that out, was it clear enough? And we can go back to that, so we can sort of do that. And then how might we improve that? So again, I'm going to sort of stay here on this page. So just thoughts on if rates go up for us.
Jen, do you want people to just kind of unmute or raise their hands, or how would you like
Raise
to
your hand
organize
and we'll
the?
try and, I'm going to try and, I'm going to see if my audio, if I start to, Emily or Steve, if I start to cut out, will you please let me know, and then I'll turn my video off again. You know, is there anybody that would like to share, again, either in the chat, or again, there's a raised hand feature. If you on your toolbar at the bottom, if you click on participants, you'll see a little raised hand. It's a little blue hand. Anyone, would anyone like to share their thoughts with us on what our approach should be, should we have that?
Sheila has a question in the chat. She asks, one question is, if rates go up, will parents be notified and given the option to return their kids to distance learning?
So yes, when you look at that distance, when you look at that limited in person, I'm going to talk about limited in person right now. We will have to keep a comprehensive distance learning model. So should they go up and you don't feel safe, or that is a concern, again, as we shared in that, we want to be clear, we're not going to force families in. That's not, I think we have amazing staff doing amazing things in the comprehensive distance learning. Again, we all know in-person is the best learning, but they're pretty rock star in some of the things that they're doing. But yeah, that would be an option.
And I think addressing how we might notify folks of that, Jen, that we could certainly send out a message that metrics are changing. And
yep, absolutely. Because again, we are looking for some ideas of what that approach might be. So let me ask, can I ask just generally, that would be, I think part of what our approach we'll think about is, you know, if they start to go up, that we would do some sort of community reach out that says we have had a 2-week look back that has had metrics go up. And again, we're trying to look in 2 week, in two 2-week increments.
2 increment periods.
2 increment periods. So that's going to be a part of that communication.
And we do post that chart that Jen showed. We post that every single week on our website. And we can certainly remind parents of where that is as we move into limited in person, so they can follow what we're following. Trina has a question about, you know, the sort of targeted information we're getting about where cases are coming from based on where Polk County is seeing those cases, and which we do get. And she said, will you have enough testing kits and contact tracing to stay open?
So yes, the testing comes, what has been shared with us in the guidance is, and again, we're working through that right now. And I want to be clear, we technically with testing, we only have to do it if we're opening up outside the metrics, which again, that because of this question right here, we are going to be moving in the direction of getting testing because we want to be prepared for that. So yes, we, from what I have read in the guidance and have started to complete the documents to get the testing, we give them the total amount of students that are in the school. And I believe there is a process through that, you know, they're going to send us a shipment and we can continue to ask for more. Please know that that we do not need to reinvent the wheel. We have a partner in Western Oregon that I am having conversation, have received some basic information. They've started some testing protocol with I believe the test, it's a rapid test. So again, kids would, and students can do it their own. They take the swab and they swab it up their nose, and then, you know, we test it, and either, again, they're going to be positive, or even if they're negative, we will potentially have, you know, all of that at our fingertips to be able to do. So I don't think the testing kits will be a problem. And we already have a process for contact tracing. So we know that as we bring more students in, I think one of the things, our constant conversation with our administrative team as we look at protocols, and then, you know, as we continue to build and share out to our staff, is, you know, what we know now, and then as we learn and adjust, if we need to adjust that contact tracing, you know, obviously we're going to look at that, but we do have, we are having to do that already as we gather information from staff. If we do have any type of outbreak, we have had cases in the school total of 3. The rest of the cases of our staff aren't quote tied to us or tied to the school district. So we think we'll be okay, and we will continue to look at our processes and improve those where we need to, because that's a big part of doing that.
Brianne has a question.
Yes, thank you. I don't know if it's a question, but I just, if we're doing phase 1, you know, those kiddos they really are in need of education. They're essentially not accessing anything right now. And if our case rates, if they're in school and our case rates increase, and it's not because of the schools, it's just a countywide thing, right? The schools are safe, as you're saying, then I think we got to leave those kiddos in school, you know, if at all possible. I would advocate for especially those phase 1 kiddos to stay in school. That would be my opinion as a community member and a parent.
Thank you. I appreciate that.
Then Christina, question or comment?
Thanks, Cece. One of the things I was thinking about, Jennifer, as you were talking about that is, and it kind of goes along with what we were just talking about, but as we talk about the phase in, so we're going to bring in our first phase, and then we're going to add as our case rate remains steady, is a consistent way to communicate, you know, where we are. So if we're starting to, if we see a rise, then we have to say, okay, we're on pause. So for those families that maybe are in this next phase, that they're also aware of kind of the importance of the social safety health criteria, but what is that consistent message for those families that perhaps are going to be in the wings waiting for the next phase, that we could communicate out when we have a change in case rate?
Yeah, and that's, appreciate that lens. And I think that's where we're continuing to talk through that. And because again, that is that, you know, we've talked about it before of, you know, getting ready. And then if we have to pause, we know that causes great anxiety, and how we work through that. So I appreciate that lens, Christina. I think Mona, I don't know who's next, Mona, and then I'll go Jason after that.
So I know I'm speaking for myself, but you asked the question, you know, what should our approach be if it went up? So my approach would be not to panic. I feel like all of you and the staff and the protocols and everything you've done have literally gotten us here. So the first thing is I would not panic. I would stay with that. I agree. Going backwards is not going to be helpful. And then part of that is, you already said it, the communication is going to be so important. And you ask, are we going to be willing? And I don't think there's one person on here that's not. So I'm saying whatever you need with your systems, myself, the context I have, our agency, whatever we can do to be communicating and be part of that. And I know, Emily, you're coordinating it, but so that's my take on it.
Yeah, and I know, Emily, for those of you, I mean, everybody has, you can email at that if you truly want to be a part of helping us in communicating out, you know, please reach out to us, because we do want to have different voices. Again, I know I'm saying it, I know our principals are saying it, but we do want a collective effort for that. And I appreciate one of the comment about not panicking. You are correct. I feel confident in our practices and the safety pieces. And again, what we have learned, even in the 2 days of limited in person, what we learned over summer school and continue to learn on a daily basis. So I appreciate that. Jason.
Thank you. I just wanted to touch a little bit on what was already said about your first question. I want to back up what Brianna said and Mona said. As a third grade teacher, one thing I couldn't imagine, getting this far with my kids and, having them start coming in for 2 weeks and then have that yanked away again. So, I think we're doing a lot of great safety things at our schools. I see it every day. And I think if we do what we're doing and we're doing it well, and, get these kids in, I don't think there's no way we could yank that away from them, excuse me, at this point. So that's my opinion.
Thanks, Jason. And I know I'm looking at the chat, so I want to just a second. I know that Sheila
got her question answered about getting more information out about what happens if a student tests positive in Lippy, and that'll be part of our protocols when we announce Lippy.
Right. We have built, and I know it was probably 3 meetings ago, we had shared a version of that with you all. So we have template letters that would be ready. We also know that there would be other communications that would, we would reach out to families. So really looking at doing that. And again, I think as we get into this, I think there's going to be 2 pieces, because again, as we get more kids in, if it's a smaller group, if we're talking about 10, the phone call and potentially, I know we do the Remind app, or potentially also an email. So looking at all of those communications as tools to be able to reach out to families should that happen. So that's appreciate that. That's a good question.
And before we get to Lindsay's question, on Janica's question, again, about segregating the source of cases, is that part of our decision making? I think what we can say about that is it's in the ODE guidance, it doesn't allow us to segregate the source of cases. It's certainly part of decision making within our ranges, because we have ranges. We have from 200 to 350. We would probably be making different decisions if the county health department is telling us that the source of the cases are less related to us. But also to know, I don't believe, from what I understand, that 50% of Monmouth Independence cases are related to congregate care. Certainly large outbreaks at Dallas Retirement Village or Capitol Manor or the Orchard Heights Senior Living in West Salem. I know that a lot of cases have been tied to those much larger retirement communities. From my understanding, we have had a couple of cases tied to our 2 congregate care facilities, Heron Point and Independence Rehab, but and so we can certainly probably get more information from the county as to those sources, but technically it doesn't completely absolve us of following the metrics.
And if anybody listened to, and I know that we have put, and I believe we're going to be putting on, if we haven't, and again, I don't look at our YouTube page every day. So I know that in our board work study session, Jackie Umstead, who is the director of Polk County Health Department, was very clear that right now in our 2 areas that those positives were coming from large social gatherings. That most of the outbreak from our community were in those social gathering types of approaches. So that she shared that with our group last Thursday. And we continue to have those conversations with them because again, Janica, we're looking at every piece of information and trying to make the best decision based off of all this information. So again, we can stay, once we open, we can continue to move forward and stay open in the safe way. Again, using all of the tools that are in front of us moving forward. Did you say Lindsay next? Cease, was that correct?
Yes.
So my thought was going back to the idea of what if rates go up again, and I'm in full agreement with everyone else that has spoken up that if we get these kids in, let's keep them in, especially these first kids that are having major lack in their ability to get education right now. But along with that, sort of like what we did at the beginning of the year when we asked parents if they are interested in hybrid or in the comprehensive distance learning, could we get, or perhaps give them the option as more of a commitment that yes, we know there's a risk that the numbers will go up, but we're comfortable with the safety standards to keep our kids in. Is that something that we can look into, getting some sort of commitment or agreement from the
Lindsay, I appreciate that. We actually believe that that's going to come. There is some pieces either from the Oregon Department of Ed or even the School Board Association that there are some of those pieces of that documentation that says, yep, we are committed to if we get in and what that would look like. So we are looking into that. Again, there are, and I hate saying this, but there are still so many moving parts. But that is one of those that we have talked about and potentially have our organizations that work with with us in the education realm that are working on what that might look like. And we have started that conversation at the high level. And then again, as we get that, we'll have that conversation with our administrators, sharing that with our staff and obviously our community. So I think that's a great point to continue to go down and look at.
Jason, did you have another comment or?
I just didn't pull it off. Sorry, Cease. Any other thoughts on, I'm just looking at the chat to make sure I didn't miss any questions.
Nope, I think we're caught up there.
So messaging, just messaging a little bit. As we get into this, and I know that communication is a balance, I'll say that. But I'm assuming right now, as we move into this, things like us continuously sharing, the screening protocols with parents, different ways. Again, that's going to probably come both from a building level perspective as we start forward, as well as a district perspective. I'm going to assume more is better as we can share specific things moving forward. Again, not everything, timeline I still think is going to be a tricky piece. With that, we want to be able to get out, and as we continue to work with as I shared before with this committee, our administrative team, and then their continued conversations with their staff. We are meeting twice a week with our administrative team. We have a very lengthy meeting tomorrow, as an example, as we continue we have actually had already a very lengthy meeting this week, and will tomorrow again, as we continue to do these final steps to move in this direction. I'm going to say as we do that, more is better than less. I know some parents may not agree with that, but I just want to, if we were to move a message of where we are might be in timeline, plus some key communication about, here's going to be some things that you're going to hear us talk about: screening, cohorting, just looking for that lens of, I'm going to say more is probably better than less.
Of course, I agree with you.
And then any thoughts on, as we message, what might help our community help us? Hear that in the right, how do we help each other as we do this?
Jen, this is Adrienne, and I was just thinking that it might make sense for our community, because educators have this tendency to use a lot of acronyms for things, and our limited in person is no different. in order to kind of help our community know what we're talking about, it might make sense to have like a cheat sheet of what we're actually saying these things are, so that you can reference back if you are trying to figure out what Lippy is, or if you're trying to figure out what contract tracing means, or, you know, whatever it is that we need to explain, but that might be helpful.
Okay, appreciate that. So maybe a little bit different than an FAQ, but a definitions type of approach as a tool.
Yes.
Appreciate that, Lee. Yes, we will do in bilingual. Absolutely. We'll continue that from that perspective. And yep, Jason, I think that unified message is going to be really, really important. How we continue to message that.
Jenica, another question or comment?
Yeah, sorry, just because just speaking from the community, I think, and maybe you're planning on this, but one question people might have or is how the process is of choosing who qualifies for Lippy. You know, I don't want the school district to get them, you know, I know can just picture parents, well, I don't know, just that maybe with the messaging, letting people know how that decision is made.
Yeah, the guidance, I appreciate that. Nope, and thank you for that. Actually in the limited in-person guidance, and we'll make sure as, because Adrian, I think you bring up a good point of definitions and helping with that. It's very clear in the limited in-person guidance that we have to be careful about not choosing programmatically. So they were very clear of, as you build this, you know, you can't force certain groups in. You need to be strategic in your first groups. And so they talk about kids that with attendance, kids with internet issues, and then how we move forward with that. So appreciate that, Jenica, because that is a part of that guidance. And we will add that and help to clarify that as we move forward. So appreciate that. I see a couple more. So either Lindsay, I'm going in the order that I see it. Lindsay, do you have another comment or question?
I did. I was thinking about the messaging out, just keeping things really short and simple. You really only get parents involved in the conversation in about the first 5 to 10 seconds. So if a message goes on for a lengthy period of time, we've lost everybody. So keeping it really short, keeping it simple, succinct, I think was the word used in the program here. And I think that would be very helpful. Also, so that our teachers are aware and can talk to the parents. I think it's easier to take communication sometimes directly from the teacher because we have a relationship as a parent with the teacher, more so than we do with the district. Not that we don't love hearing your voice, Jen.
I'm okay with that. I'm okay with that.
Sort of that already we've built up that trust and that relationship. So sometimes getting it directly from the teacher, I think is also helpful. And then really reiterating to the community that now that the metrics have changed, it's really more on us as a community and our safety protocols within our community as to whether or not our kids get to be back in school. The governor's given us this big window. So we as a community, it's now on us to be safe so that our kids can get back into school. And I think that's the point that maybe people need more emphasis on. What we do every day is going to have the biggest impact on getting our kids back into the classroom.
I have a follow-up question for you, Lindsay, because so often when we're trying to share information, there's just frankly a lot of information and we're trying to be clear at the same time. Can you help me understand a little bit? I'm all for short and sweet, but for people who want more information, maybe we can just say that in the message to go to the website for like longer, lengthier details. Would that help? Would that work?
That's what I was thinking, kind of like just what we have in the question for us as the group. Do people understand what safety protocols mean? What are the basic safety protocols? And what is the limited in person? That's been mentioned a couple times. You know, we have the acronyms for that, but do they know that that means kids 2 hours a day in the classroom in small groups, only those with, deep-seated educational needs starting out. Something just simple, just to not get lost in the process of trying to describe everything. And then let's shift them over to the website where if they want the detailed information, boom, everything is there. But here's the process. And if you want to know more, this is where we would like you to go for that information. If that makes sense. But just,
Perfect.
simple
Yes.
explanations of what we're talking about. Basic information. If they want more, send them to where they can really do their research and read up on it.
Lindsay, thank you for that input. I appreciate it.